Medical imaging is the backbone of modern diagnostics, especially for lung diseases. But what if AI could assist radiologists in diagnosing faster and more accurately? Welcome to the Fantastic Datasets channel. In this video, we'll explore the ChestX Dataset, a valuable resource for developing AI models that assist radiologists in diagnosing lung diseases, improving efficiency, and supporting patient care. Since the discovery of X-rays in 1875, these remarkable beams of photons have revolutionized medical diagnosis, allowing us to look inside the human body without making a single incision. You can think of X-rays as photos built from high-energy photons that pass through body tissues so that we can see what's going on inside the body. Just like visible light, X-rays are less likely to penetrate denser materials, such as bones or metal implants. Conventional X-rays, with their iconic white bones on a black background, are much like photographic negatives. The darkest areas are where photons pass freely through soft tissues and air, while the bright, sharp whites mark denser structures like bones, where photons are blocked. The ChestX Dataset was created to empower researchers and developers with high-quality chest X-ray data collected from year 1992 till 2015. In 2017, National Institutes of Health publicly released this collection of chest X-rays. Originally released with 8 disease categories, the dataset has since been expanded to include 15 labels, 14 disease categories like pneumonia, fibrosis, and emphysema, along with a no finding label for healthy cases. These disease labels were extracted from the radiology reports using NLP techniques, with over 90% accuracy, ensuring their reliability for AI training. What makes this dataset truly unique is its scale and scope. With over 112,000 X-ray images from approximately 32,000 patients, it is one of the largest publicly available resources for frontal view of chest X-rays. Chest X-rays in the dataset are captured in 2 orientations, posterior-anterior, PA, and anterior-posterior, AP. About 60% of the dataset's images are PA, while 40% are AP. But what's the difference, and why does it matter? Let's explore these 2 orientations in detail. In the PA view, the X-ray source is behind the patient, with the chest and belly closer to the detector. This reduces magnification, offering a more realistic view of the heart and lungs. It's why the PA view is preferred for accurate measurements like the cardiothoracic ratio and is considered the gold standard in chest X-rays. In contrast, the AP view places the X-ray source in front of the patient. The heart and organs are farther from the detector, creating magnified shadows. While this limits its use for cardiothoracic measurements, the AP view is still valuable when doctors need to focus on swellings or abnormalities that benefit from magnification. The ChestX dataset reflects a diverse group of patients, with 56% male and 44% female representation. However, when we look at disease categories, we notice a significant imbalance. Some diseases have abundant samples, while others are underrepresented, posing challenges for training balanced machine learning models. These imbalances can lead to biased models, making it critical to implement strategies like resampling, weighting, or advanced techniques like synthetic data generation to ensure robust AI model performance. By understanding the X-ray orientations and the dataset's demographics, we can better prepare machine learning models to tackle real-world diagnostic challenges, ultimately improving patient outcomes worldwide. Accessing the ChestX dataset is simple. It's originally hosted on the NIH's public repository and you can download it in few clicks. For ease of access, it is also available on other popular data repositories such as Kaggle and Google Cloud. You can find the link of these data repositories in the description of this video. While the dataset is free, it has a few attribution requirements. Acknowledge the NIH Clinical Center as the data provider. Link to the official download page. and include the 2017 CVPR paper citation. After all, responsible science is impactful science. Now, let's talk fair, because the ChestX dataset truly plays fair. But what does FAIR mean? FAIR is an acronym for findable, accessible, interoperable, and reusable, a set of principles designed to ensure that data is easy to find, use, and share. The ChestX dataset is findable, publicly hosted on an accessible NIH repository, making it easy to locate with proper documentation. It's freely available to everyone, with clear attribution requirements and license. It ensures that users know how they can access, use, and share the data. Without a license, the accessibility of the data is ambiguous, as users may be unsure of legal permissions. ChestX provides images in standard formats like PNG, ensuring compatibility with various tools and platforms. Hence it is interoperable. ChestX data was released to drive further research with well-defined disease labels, detailed metadata descriptions, and clear licensing terms. These features ensure the dataset is reusable, enabling researchers to understand, adapt, and extend it for broader scientific endeavors. Of course, we cannot discuss medical data without addressing privacy and ethics. The ChestX dataset ensures patient confidentiality through full anonymization. Usage guidelines emphasize responsible research. Ethical responsibility goes beyond compliance. It builds trust between hospitals and researchers, enabling the continued sharing of data for advancements in healthcare. ChestX 8 and 14 datasets have been instrumental in advancing AI-driven diagnostics, but these are not perfect. Let's explore the challenges researchers face when using them. One major limitation is the dataset lacks manual annotations for diseases. This makes it nearly impossible to verify if the AI-detected regions of interest actually corresponded to problematic areas in the X-rays. The image labels in ChestX were extracted using NLP from radiology reports. While the accuracy is estimated to be over 90%, errors can still slip through. Even small inaccuracies in labels can mislead AI models. It can add bias to AI predictions. Another challenge? Very few disease regions in this dataset come with bounding boxes. This limitation hampers the AI's ability to precisely learn where to focus its attention. Due to privacy and ethical considerations, radiology reports are not shared publicly. While this protects patient confidentiality, it also limits researchers' ability to verify AI-detected disease regions and refine diagnoses. In December 2017, CheXNet was introduced, built on the ChestX 14 dataset. During the study they compared CheXNet model performance with 4 radiologists. This 121-layer dense convolutional neural network or DenseNet addressed a key deep learning challenge by enhancing information and gradient flow through its layers and using ImageNet pre-trained model weights, making it possible to optimize extremely deep networks. CheXNet excels at identifying subtle patterns in chest X-rays, providing disease probabilities that help pinpoint conditions such as pneumonia with high accuracy. This ability significantly reduces the chance of misdiagnosis. By integrating with clinical workflows, CheXNet acts as a decision support tool. It assists radiologists by providing quick preliminary diagnoses and highlighting areas of concern. This partnership enhances diagnostic accuracy, speeds up the process, and reduces the workload on radiologists. The ChestX dataset bridges the gap between radiologists and AI, offering a foundation for innovations that can save lives. With its unique properties, challenges, and potential, this dataset paves the way for the future of medical imaging research and innovation. It assists doctors in early diagnoses of diseases like pneumonia, hernia, and infiltration with a reduced error rate. Are you ready to explore the possibilities? Scan the QR codes to access the NIH ChestX dataset paper or download the data. Thank you for your time. Together, we're building a healthier, smarter future.